Hello there. I'm going to talk about a very interesting mental disorder today, which most of us are suffering from. It could be you, me, or any one of us. Because the special thing about this disorder is that the person who has doesn't know about his problem. And if you remind him, he will never accept that he is suffering from any disorder. And that is the personality disorder. So before I go deeper into the disorder, let's understand the basics so that we can have maximum understanding of this disorder. First, meaning of personality. It can be defined as the distinctive pattern of thought, emotion, and behavior that make up an individual's style of interacting with the physical and social environment. And this is also the dynamic organization within the individual that determines his unique adjustment with the environment. And what are the personality traits? These are normal and prominent aspects of personality, and these are broadly described by the Big Five. First, openness to experience. People who are high in openness enjoy adventure. They appreciate art, imagination, and new things. They will be sensation seeking. They love to have new experiences like bungee jumping, skydiving, etc. And people who are low in openness would avoid new experiences and they are not adventurous. Second is the conscientiousness. People high in conscientiousness are organized and have a strong sense of duty. They are disciplined and achievement focused. They are good planners. People low in conscientiousness are more spontaneous and freewheeling. They may be careless. Third is extraversion. On the basis of this distinguished personality trait, we easily differentiate the people into extrovert and introvert. Let me explain you the meaning of extrovert and introvert. Extrovert people are very talkative. They speak a lot. They will be sociable and mostly they prefer group activities. They can impress a big audience. Introvert, they speak less. They need their alone time and they prefer solitary activities. It doesn't mean they are shy. They can perfectly be fine and at the same time they will be charming at parties. Fourth, agreeableness. It measures the extent of a person's warmth and kindness. Agreeable people are very trusting, helpful, and compassionate. Disagreeable people are very suspicious of others and they are less likely to be cooperative. Fifth, neuroticism. It refers to the degree of emotional stability. People who are high in neuroticism very frequently and easily slip into anxiety and depression. Any kind of criticism will be difficult to handle for them. And people who are low in neuroticism, they tend to be emotionally stable. And now you should understand that the personality disorders result when these personality traits become abnormal, that is, become inflexible and maladaptive, and cause significant social or occupational impairment or subjective distress. We can also say that if the personality of an individual deviates from the social norms and is the reason for his unhappiness and impairment, he is diagnosed with a personality disorder. Overall, the prevalence of personality disorder is up to 20%. Onset is in early adulthood or adolescence. Symptoms remain stable up to the adult life, and resolution of abnormal patterns of behavior occurs by 40 years of age, which is known as maturing. And this personality disorder is egocentric. Egocentric, it means the individual doesn't find anything wrong with himself and hence they do not seek any psychiatric help. I'm going to demonstrate you that if you are going to inform someone, if you are going to remind someone that he is suffering from a personality disorder, how he is going to react. I'll show you here. Dude, I think you are suffering from some problem. Some of your activities I did not like. I think there is some problem and you should see a psychiatrist. So basically you are saying that my activities are abnormal and what I'm doing is not normal, right? For your kind information, I am completely alright. Who are you, man? Who the hell are you to tell me that I have some problem? I think you need a psychiatrist. You look like a psycho. Go to hell. See, I told you, right? I told you. If you inform someone that he is suffering from a personality disorder, he will never accept. Because he is suffering from a personality disorder, even that person will not know that he is suffering from any person, will not. Now I would like to elaborate the word egocentric and ego dystonic. I asked one question during my lecture that if a person is gay or lesbian, is it normal or abnormal? Some medicos replied, sir, it's normal, and some replied, it's abnormal. And one of them replied, sir, it must be completely normal. After all, the government has legalized it, right? Okay, fine, jokes apart, but I'm going to explain you. If a person is happy with his sexual orientation, whether he is homosexual or bisexual, it is egocentric. It means it satisfies his ego. And if a person is not happy with his sexual orientation and he is getting anxious and getting panicked that he won't be accepted by society and his family, it's ego dystonic. Means it does not satisfy his ego. Now let's understand the personality disorders. DSM-5 has classified personality disorder into 3 clusters: Cluster A, Cluster B, and Cluster C. Cluster A contains disorders which are thought to be odd and eccentric and somewhere similar to schizophrenia. These include like paranoid, schizoid, and schizotypal. Cluster B has disorders and they are considered emotional, erratic, and dramatic, and these are histrionic, antisocial, narcissistic, and borderline. Cluster C has disorders which are considered anxious and fearful, anxious and aversion. These include avoidant, dependent, and OCD personality disorder. Let's understand all of them one by one. First, Cluster A. Paranoid personality disorder. The people who are suffering from disorder, they will have the paranoia, relentless mistrust and suspicious of others without adequate reason to be suspicious. They are very, very sensitive people and they believe in the conspiracy theories. How we are going to manage them? Psychotherapy is the treatment of choice, and medications like benzodiazepine and antipsychotics can be used for agitation and paranoia. Schizoid personality disorder. They are emotionally cold, socially detached, self-absorbed, and lost in daydreams, and they may have their own fantasy world. Solitary and sheltered lifestyle they have, and they look very, very secretive. You appreciate him or criticize, he will be indifferent. They may have lack of sexual interest as they are uncomfortable with human interaction. How to manage them? Of course, psychotherapy and medicines like benzodiazepine, antipsychotics, and antidepressants. Schizotypal personality disorder. They have unconventional and odd beliefs, or you can say the magical thinking. Superstitious nature they have. Socially withdrawn with odd, eccentric, and inappropriate behavior. So they do not have any close relationship. They have unusual perceptual experiences, vague, circumstantial, or stereotyped thinking, and sometimes short-term psychosis like illusion, hallucinations, and delusions like ideas they will have. These all symptoms are almost similar to schizophrenia. So in ICD-11, this is no more considered as a personality disorder. It is classified as psychotic disorder along with schizophrenia. So how we are going to manage this personality disorder? Psychotherapy and medicines like antipsychotics, antidepressants, and benzodiazepine. And whatever we have learned so far about cluster A personality disorder like paranoid, schizoid, and schizotypal, they all have some similar features like schizophrenia. So cluster A disorders are considered as schizophrenic spectrum disorders. Means they lie somewhere in between the normal and schizophrenia. Now let's understand the disorders of cluster B. First, histrionic personality disorder, full of drama. Patients behave in extroverted way. They exaggerate the expression of emotions, shallow and labile affectivity. They have attention-seeking attitude. Sometimes they behave in a seductive manner and use physical appearances to draw the attention. There is an attempt to look beautiful and gorgeous. Associated features may include egocentricity, self-indulgence, anticipating appreciation every time, feelings that are easily hurt, and persistent manipulative behaviors to achieve own needs. Anger outbursts or the tantrums are very, very common. Societal gestures may be made at times. Interpersonal relationships are often stormy. Let me remind you that some features of histrionic personality disorder exist in every household. Our moms, right? I'm not saying that our moms has this personality disorder. I'm saying some features like exaggeration and full of drama. Have a look. Excuse me, mom, I need 15,000 bucks. 15,000 bucks. Why? Actually, my friends are going for a picnic to Goa. I also want to go there. Please give me 15,000 bucks. Goa! 15,000 bucks! Mom, it's just 15,000. Do you understand the importance of 15,000 bucks? Your father is working day and night. He's working so hard and you just want to waste his money. You want to go to Goa. Okay, mom, fine. I'm not going to go to Goa, fine. Okay, I will go to see some museums, okay? And I will also go to visit some temples. Museums and temples also. Okay, fine. I will give you 17,000 bucks, okay? And visit some historical places also, okay? Don't go to Goa. Goodbye. So the most successful method of management is psychoanalysis and psychoanalytical psychotherapy. Narcissistic personality disorder. People who have this disorder will have ideas of grandiosity and inflated sense of self-importance. He will think this is all about me and I'm the best. That is heightened sense of self-importance. They believe that they are special and very talented. They are preoccupied with fantasies of unlimited success. They have lack of empathy with others and exploited behavior. They always want admiration. They should always be praised by everyone. At the same time, they are unable to face any criticism. They have fragile self-esteem and underlying sense of inferiority, easily get depressed by minor events. They are susceptible to have development of depression when faced with rejection. I will demonstrate you here. Dude, I think you look good. I look good, right? Actually, very good. What a personality I have, man. I think I'm the best. This is all about me. This is all about me. Everyone appreciates me. Really, I'm so good. I'm so good. Dude, I think you are losing some hairs. And very soon you are going to be bald. I am really good. I'm good. Who is he, man? He doesn't know anything, okay? I'm good. See, I told you, narcissistic people. I'm sure you might have come across with so many people like him. Okay, fine. So how we are going to treat the narcissistic personality disorder? First of all, always it's psychotherapy. And patients may go into depression, so we can use antidepressants. BPD, which is known as borderline personality disorder. It is also known as emotionally unstable personality disorder. They are always in the state of crisis. They have significant mood swings. They may start feeling angry, anxious, or frustrated without any reason. Unstable and intense interpersonal relationships pattern they will have. They are indulged into self-destructive acts like overdosage of medicines, slashing of wrists. They harm themselves simply to seek help from others, or express anger, or just numb themselves to the overwhelming, painful feelings they have. These patients are also very impulsive in certain areas like spending, sex, and substance use. And they excessively use a defense mechanism of splitting, wherein they consider each person to be either all good or all bad. So this is really a serious problem, how we are going to manage them. First is psychotherapy. Second is the dialectical behavior therapy, This is a type of CBT where patients are motivated to think positive and not to get involved into self-destructive acts. And pharmacotherapy like antidepressants, antipsychotics, and mood stabilizers like lithium and valproate. Antisocial or dissocial personality disorder. The name itself, antisocial, easy to understand, right? This disorder is synonymous with old terms like psychopathy and sociopathy, but does not always mean the criminal behavior. They have persistent attitude of irresponsibility and disregard for social norms, rules and regulations, and incapacity to maintain enduring relationships. They do not have regard for rights of others and frequently violate them. They frequently get involved in unlawful behavior such as lying, theft, and deception. They easily get aggressive and violent. They have lack of remorse and guilt for others. Substance use disorders like alcoholism is frequently seen in these patients. History of the conduct disorder in young age may support the diagnosis further, and there are no any psychotic feature in this personality disorder. So how we are going to treat? First of all, it's psychotherapy and some medicines like beta blockers and the carbamazepine. Let's talk about cluster C personality disorders. First of all, avoidant or anxious personality disorder. What will happen to a boy who proposed many girls and got rejected by all? What will happen to a boy who got discriminated and was not allowed to play with other kids? What will happen to a man who got rejected by all companies for a job? They will develop fear of rejection. They are afraid that they would be criticized or rejected in social situations. They have persistent and pervasive feelings of tension and apprehension and a belief that they are inferior to others. Actually, they develop inferiority complex. So they tend to remain socially withdrawn. They avoid all social or professional activities that involve significant interpersonal contact because of fear of criticism, disapproval, or rejection. So how we are going to treat avoidant personality disorder? Individual psychotherapy or group psychotherapy? CBT, assertiveness training, and medicines like beta blockers and SSRI. Dependent personality disorder. These patients are dependent on others for everyday decisions. All major decisions in their lives are taken by someone else. They seek excessive amount of advices and reassurance from others. They feel uncomfortable or helpless when they are alone. They have difficulty in saying no to others because of fear of loss of support. And treatment is psychotherapy. Benzodiazepine and beta blockers are given for symptomatic relief. Now, very important personality disorder, obsessive compulsive personality disorder. OCD. This is different from the neurotic disease OCD. Neurotic is ego dystonic, but now we are talking about personality disorder OCD. This is ego syntonic. These patients are preoccupied with rules and regulations. They have feelings of excessive doubts and preoccupation with details and perfectionism, which always result in significant delays. They are inflexible and insist that others agree to their demands. They are obsessed with their work and excessively devoted to work and may not have time for leisure activities. They are very formal and serious and often lack a sense of humor. How we are going to manage the patient of OCD personality disorder? 100% psychotherapy. So the personality disorders according to cluster A, cluster B, cluster C are over. So this was all about the personality disorders. I hope you have enjoyed and learned all the types of personality disorders. Thank you so much.